Okay, let's dive into something incredibly specific today, but profoundly important if you share your life with a beloved dog or cat. We're talking about a type of cancer in their lungs that's, well, surprisingly rare, yet when it does show up, it's almost always serious.
That's right. Primary lung tumors in pets aren't nearly as common as, say, skin lumps or even cancers that have spread to the lungs from somewhere else. But the ones that start in the lung itself, they are unfortunately very frequently malignant.
And today, we're narrowing our focus even further. We're doing a deep dive specifically into squamous cell carcinoma, that's SCC, in the lungs of dogs and cats. We've got some really detailed information in front of us, which lets us get a, really close look at this particular disease.
Yeah, and our mission for you is to really unpack all of it. We want to make sense of what lung SCC is, how it tends to behave, how you find it, the options for tackling it, and crucially, what the general outlook might be.
Yeah.
Think of this as trying to cut through some of the noise to give you the essential knowledge.
Okay, perfect. So let's start at the beginning then. What is lung SCC, just on a fundamental level?
Simply put, it's a malignant tumor. It grows from a specific type of cell that lines the airways inside the lungs. Those are the squamous epithelial cells. It falls under that broader umbrella of primary lung cancers.
And you mentioned it's rare. Like, how rare are we
The
talking?
numbers from the sources, yeah, they confirm it's pretty uncommon. Primary lung tumors overall make up only about 1% of all tumors found in dogs. And SCC is just a small fraction of those primary tumors, maybe somewhere in the range of 1 to 5%.
Wow, okay. And cats. Similar story.
Pretty similar. Primary lung tumors are also uncommon in cats, and again, SCC is a very minor player within that group, perhaps around 2 to 7%.
Okay, so it's really not something you hear about every day. Why is it so important to understand then, despite being rare?
Because when it does happen, like we said, it's almost always malignant. That means it has that potential to spread. And it has some specific quirks and behaviors, especially in how it can spread, and sometimes the really unusual physical signs it can cause. Recognizing those is really important for vets and, for owners too.
That makes total sense. So who does this rare tumor typically affect? Are there particular types of pets more prone to it?
The data points pretty clearly towards older animals. Typically, we see this diagnosed in dogs around 11 years old, and cats maybe a bit older, around 12 years old on average.
Any specific breeds pop up in the information?
Yes, for dogs, the sources do mention some potential breed predispositions. Things like boxers, Dobermans, Australian Shepherds, Irish Setters, and Bernese Mountain Dogs. For cats, there's a general note about Persian cats maybe being more prone to pulmonary carcinomas in general, though perhaps not specifically SCC linked all the time.
All right, so the big mystery then. What causes it? Do we know?
That, unfortunately, is still the big question mark. The exact cause of lung SCC in most pets is, well, largely unknown.
Hmm. Are there suspected factors, like, environmental things we hear about with human lung cancer, like secondhand smoke?
Environmental factors are definitely suspected. Things like passive smoke exposure, maybe living in urban areas with more air pollutants, those are often considered. But the sources are pretty careful to note that a definitive link, one that's consistently proven across studies, well, it's hard to establish.
Right.
It is mentioned as a sort of grim specific example that dogs that were actually trained to smoke cigarettes for studies can develop lung cancer. But proving that link from just typical household exposure is really complex.
Yeah, that's a huge leap, isn't it? Correlation versus causation.
Exactly. Chronic inflammation in the lungs, maybe genetics, those are also sort of tossed around as potential contributors. But finding that precise trigger, it remains elusive for most cases we see.
Okay, so once this tumor decides to grow, how does it typically behave? Inside the lung, and, where does it like to go?
Locally, it usually starts as a single mass, a solitary mass, although occasionally you might see more than one focus. And it's locally invasive. That means it can grow into the surrounding lung tissue, the airways, even the blood vessels right there.
And because it's malignant, spread metastasis is a major concern.
Absolutely critical. It has significant metastatic potential. The first place it commonly spreads is usually the regional lymph nodes, right there in the chest. Those are the tracheobronchial nodes. It can also seed new tumors within the same lung, or sometimes jump to the opposite lung.
And then potentially further afield, too.
Yes, absolutely. It can travel via the bloodstream to distant organs. The sources specifically mention bone, the brain, and even the skin as potential sites for metastasis.
And this distant spread, especially to bone or skin, that brings us to those really striking, sometimes visually obvious things you hinted at earlier, the paraneoplastic syndromes, where the tumor causes problems elsewhere, but not because the tumor itself is actually there. At first, anyway.
Exactly. These are really fascinating, sometimes quite dramatic manifestations. The tumor releases certain substances that then affect other body systems, often far from the chest.
Okay, tell me about the one we often see in dogs.
That's called hypertrophic osteopathy, or just HO. Picture this. A dog suddenly becomes lame, seems really sore on their legs, and when you look closely, or maybe feel their limbs, particularly the lower parts of the long bones, they might look or feel swollen. That swelling is actually painful new bone formation along the surface of the existing bones. While other things can cause it, HO is sometimes strongly associated with an underlying primary lung tumor, like SCC, in dogs.
Wow. So a strange lameness, maybe some limb swelling, might actually be the very first sign an owner notices, and it points back to something serious happening way up in the chest that's incredibly important for people to know.
It really is. It connects the dots in a way you wouldn't expect.
And cats, well, they have their own unique and equally striking version. It's called feline lung digit syndrome.
Lung digit syndrome. Okay, the name is pretty descriptive there. It really is.
Yeah.
This is where the lung tumor now, most commonly it's adenocarcinoma, another type, but it definitely can be SCC too.
Hmm.
It metastasizes specifically to the digits, so the toes, the paw pads, and it causes swelling, obvious pain, and lameness in those digits.
So if you see digital swelling and lameness in a cat, especially an older one,
It's a major red flag. You absolutely have to check the lungs.
that changes the whole perspective. Swelling in the paw could actually mean lung cancer.
Wow. It's a classic example, really, of how this disease can present in these unexpected, sometimes quite dramatic ways.
Okay, so we've talked about how it grows and spreads, including these really unusual syndromes. What other signs might an owner actually see in their pet day-to-day? Things maybe a bit more typical?
Well, this is where it gets tricky again, because the signs are often very subtle or nonspecific or sometimes completely absent. The sources note that a pretty significant percentage, maybe around 25 to 30% of these, are actually found incidentally, like when a chest x-ray is done for a totally different reason.
But if the pet is showing symptoms, what are the common clues we should be aware of?
Respiratory signs are definitely the most frequent. A chronic cough is very common, seen in a really high percentage of symptomatic dogs. The sources say anywhere from 50% up to 90%.
Okay, so a persistent cough is a big one.
Yeah. Also, difficulty breathing, maybe rapid breathing, dyspnea to tachypnea. Exercise intolerance, they just don't have the same stamina. Less commonly, but definitely more concerning, you might see them actually coughing up blood. That's called hemoptysis. Or a vet might hear abnormal lung sounds during an exam.
And what about more general feeling unwell kind of signs?
Sure. Things like lethargy, just being tired, weight loss, maybe poor appetite, sometimes a fever. But again, none of those are unique to lung cancer, are they? They could be anything.
Right, very nonspecific. And we should definitely reiterate those paraneoplastic signs we just discussed.
Absolutely. Keep those right at the forefront of your mind. Lameness or limb swelling in dogs, possibly pointing towards that hypertrophic osteopathy, and especially lameness or those swollen, painful digits in cats, suggesting the lung digit syndrome. The sources also mention some really rare neurologic signs like megaesophagus or even weakness in the back legs. So as you can tell, the signs can be all over the map, which really makes getting to a diagnosis challenging sometimes.
Yeah, it sounds like it. Given how subtle or varied those signs can be, how do you actually pin down a diagnosis? It sounds like you need to do some pretty serious detective work beyond just a standard checkup.
You absolutely do. It really requires a multimodal approach.
Yeah.
You know, putting different pieces together. It always starts with a thorough history, asking the owner exactly what they've been seeing at home, and a careful physical exam. That means listening very carefully to the lungs, feeling for any enlarged lymph nodes, and importantly, checking those limbs for any swelling or pain, even if the owner hasn't specifically mentioned lameness.
Okay, history and physical. What's usually the first imaging step?
Typically, thoracic radiographs, so chest x-rays. And you usually want 3 different views to see things from all angles. X-rays can often show a mass, maybe pick up enlarged lymph nodes, possibly fluid buildup in the chest cavity, which is actually a bit more common in cats with this.
Yeah.
They might also show those bony changes of HO if that's happening. But X-rays do have limitations. They can definitely miss smaller lesions or not show the full extent.
Right, so that's where the gold standard imaging comes in.
Precisely. Computed tomography, the CT scan of the thorax, is really considered the gold standard here, especially when you're trying to figure out exactly what's going on and, crucially, planning for treatment like surgery.
Why is CT so much better than a regular X-ray for looking at lungs?
It's just significantly more sensitive and gives you vastly more detail. A CT scan can pick up tiny little nodules that you'd completely miss on an X-ray. It gives you the precise location, the size, the shape of the tumor. It helps you assess if it's invading nearby structures like airways or blood vessels, and it gives a much, much clearer picture of those regional lymph nodes, which, as we'll get to, is absolutely vital for figuring out the prognosis. It's pretty much essential for planning surgery effectively.
Makes sense. And sometimes they use contrast dye with the CT.
Yeah, using an intravenous contrast agent during the scan can also help highlight the tumor and differentiate it from surrounding tissues or fluid.
Okay, so the imaging gives you a really strong suspicion, maybe shows you the extent, but how do you get that definitive answer, that proof that it is SCC?
Right, you need cells or tissue. You need a sample for cytology or, ideally, histopathology. There are a few ways to try and get that. A fine needle aspirate, or FNA, where you use a thin needle guided by ultrasound or CT to poke into the mass and pull out some cells. Though the sources do mention potential risks with that, like possibly collapsing the lung or causing some bleeding. And the sample you get might not always be enough for a diagnosis. It can be variable.
Are there other ways?
If the tumor is near the main airways, sometimes doing a wash like a bronchoalveolar lavage, BAL, or a tracheal wash, can collect cells that have sloughed off.
But the most certain way to get that definitive diagnosis
Is usually from a surgical biopsy, or, ideally, complete surgical excision of the mass. You remove the whole thing or a large piece of it and send that to the pathologist. This is often done as part of the actual therapeutic surgery itself. The pathologist not only confirms, yes, this is SCC, but they also assign it a histologic grade.
A grade. What does that tell you?
It basically tells you how aggressive the cancer cells look under the microscope.
Yeah.
A higher grade usually means more aggressive behavior and potentially a worse prognosis. So that's important information too.
Got it. And checking for spread, the staging part, happens alongside all this.
Oh, absolutely crucial. Assessing those regional lymph nodes is paramount. You can evaluate them with the imaging, especially CT. You can try to aspirate them with a needle, again, maybe guided by ultrasound or CT. Or, ideally, you remove them or biopsy them during the surgery. Their status, do they have cancer cells in them or not? That dramatically impacts the outlook and treatment plan.
So lymph node status is key.
Huge. Staging might also involve doing an abdominal ultrasound to check organs there, and sometimes specific bone imaging if there's suspicion of spread to bone, especially if you're seeing those perineoplastic signs like HO or the digital lameness.
It sounds like a very thorough process is needed. What else could a mass in the lung potentially be? What are the other things the vet has to sort of rule out?
Yeah, vets call this list the differential diagnoses. Other possibilities that might look like lung SCC on imaging could include other types of primary lung tumors. Adenocarcinoma is actually more common than SCC, for instance. Or very commonly, it could be cancer that has spread to the lungs from somewhere else entirely in the body.
Right, metastatic cancer.
Exactly. Though that often looks different on imaging, typically multiple nodules scattered throughout the lungs, whereas SCC often starts as that single solitary mass. Less commonly, you could have non-cancerous things mimicking a tumor. Fungal infections can cause inflammatory masses called granulomas. You could have a bacterial abscess, a fluid-filled cyst, or even just a really severe localized patch of pneumonia.
Okay, lots to consider. So once you've gone through all that, you've confirmed it's lung SCC, what are the treatment options on the table?
For a localized tumor, meaning it appears confined to one area on all that staging work and hasn't clearly spread the primary and definitely the most effective treatment, is surgical excision, removing it.
So taking out the affected part of the lung?
Exactly. The procedure is usually a lobectomy, removing the entire affected lung lobe. The goal is complete removal of the tumor with clean margins around it. This really offers the best chance for long-term control, possibly even a cure in some cases. And that pre-surgical CT scan is just invaluable for mapping this out and helping the surgeon plan.
And they address those crucial lymph nodes during the surgery, too.
Yes, absolutely. The regional lymph nodes should be carefully evaluated, sampled, or ideally removed during the same surgery. Knowing their status is just so vital for prognosis and deciding if any further treatment is needed.
Is this major surgery?
Yes, it's typically open chest surgery, called a thoracotomy, though for some smaller, well-placed tumors, minimally invasive techniques using cameras and small instruments, thoracoscopy might be an option in very select cases, usually at specialty centers.
What about other treatments people might think of, like chemotherapy or radiation? Where do they fit in?
Those are generally considered adjuvant therapies, meaning used in addition to surgery or maybe instead of surgery if it's not an option for some reason. However, the sources are pretty clear that chemotherapy, as a routine follow-up after surgery for primary lung carcinomas like SCC in pets, is generally not considered highly effective. Its overall benefit is often seen as controversial or limited.
So it's not like chemo for lymphoma, where it's the main treatment.
No, not typically for this.
Hmm.
It might be considered if there's proof the cancer has already spread, or if the tumor was very high grade, or if the surgeon wasn't able to get it all out completely, but it's not usually a standard recommendation just because it was SEC, and is not expected to be curative on its own. There are various drugs mentioned: cisplatin, carboplatin, doxorubicin, bidoxantrone, menorborine, but none really stand out as a home run.
And we need to be careful with cisplatin in cats, right?
Absolutely. Never use cisplatin in cats. It's fatally toxic to them. Even in dogs, it needs careful handling and hydrogen protocols. Carboplatin is often preferred as it's generally safer.
Okay. What about radiation therapy?
Its role for the main tumor in the lung itself is also quite limited. The lungs are constantly moving with breathing, which makes targeting tricky, and radiating lung tissue can cause significant side effects, like pneumonitis or fibrosis. It's more often considered for palliative purposes, maybe to help manage pain from the tumor, or shrink a non-surgical tumor a bit to improve breathing comfort, or it might be used to target painful metastatic sites, like a spot in a bone.
Any newer radiation techniques?
Stereotactic radiosurgery, or SRS-SRT, is mentioned. This is a very advanced, high-precision technique that delivers high doses very accurately. Its availability is limited, but it's an area of ongoing research for lung tumors.
And if aggressive treatment isn't an option or maybe isn't working?
Then palliative care becomes the focus. And it's always important, really. This involves managing symptoms to maintain the best possible quality of life for the pet for as long as possible. Things like medications for pain relief, cough suppressants if the cough is distressing, maybe antibiotics if a secondary bacterial infection develops in the damaged lung tissue.
Okay, we've covered what it is, how it's found, how it's treated. Now for the really big question, I think. What can an owner realistically expect? What's the prognosis look like?
This is probably the most variable part, and it really truly hinges on two main factors we've touched on. One, was the surgery successful in removing all the visible disease? And two, maybe even more importantly, had the cancer already spread at the time of diagnosis and surgery?
So getting it out completely before it spreads is the absolute key.
That's the take-home message. The sources are very clear on this. Dogs and cats where you have a solitary tumor, it's completely removed surgically with clean margins, and there's no evidence of spread, especially not to those regional lymph nodes. That's what vets would call stage eye disease. Those pets have, by far, the best outlook for long-term survival.
And what do the survival times look like in those best-case scenarios? Can you give us some numbers?
Yeah, the numbers show a pretty dramatic difference. With that complete surgical removal and no detectable metastasis, the median survival time cited in the sources is typically over 300 days. So, well over a year, often significantly more for some individuals.
That's a good chunk of quality time. Okay, what about the other end of the spectrum if things aren't so ideal?
Well, if the surgical removal is incomplete, maybe they couldn't get clean margins, or, critically, if the cancer has already spread to the regional lymph nodes or elsewhere in the lungs when it's diagnosed, then the median survival time drops, and drops very significantly, often cited as being less than 75 days. So just a couple of months, unfortunately.
Wow, that's a really stark difference. It just highlights again why finding it early before that spread happens is so incredibly vital.
It absolutely underscores the importance of all those diagnostic steps we talked about, especially that thorough staging with CT and checking the lymph nodes carefully.
Yeah.
Just looking at dogs specifically, while stage I can mean over a year, if it's spread just to those regional lymph nodes, the typical survival drops to maybe 2 to 6 months. And if it's gone to distant sites, you're often looking at weeks to maybe a couple of months.
And how does the prognosis generally look for cats compared to dogs?
Overall, the prognosis in cats is often considered a bit less favorable than in dogs for primary lung tumors. Though surgery for maybe moderate grade tumors can still yield decent median survival times, maybe 12 to 18 months in some reported cases. But for the more aggressive types or more advanced stages, it's usually much shorter than that.
And that really unique feline sign, we talked about the lung digit syndrome, if you see that.
Yeah, seeing metastasis to the digits in a cat, unfortunately, indicates pretty advanced disease already. It carries a very poor prognosis. Typical median survival times reported are only around 1 to 3 months once you see that sign.
Gosh, are there other factors that tend to worsen the outlook besides the spread?
Yes. Besides metastasis and incomplete surgery, other negative prognostic factors mentioned in the sources include things like a really large tumor size, say over 5 centimeters. Also a very central location within the lung, which can make complete surgical removal much harder. If the pet is already showing obvious clinical signs at the time of diagnosis, that's generally worse than finding it incidentally. The presence of fluid building up in the chest, that pleural effusion, and, as we mentioned, a high histologic grade from the biopsy, meaning the cells look very abnormal or poorly differentiated under the microscope.
Makes sense. After treatment, particularly if they have surgery, is ongoing monitoring important?
Oh, absolutely critical.
Mm.
Postoperative care is just the start. Regular recheck appointments are essential. These usually involve physical exams, follow-up chest x-rays, and potentially even repeat CT scans at certain intervals over time. The goal is to monitor closely for any signs of the tumor recurring locally, where it was removed, or for any new signs of metastasis popping up elsewhere. And you definitely keep monitoring those limbs, checking for any signs of that HO or digital spread either returning or developing later on.
Thinking about all this really complex information, how important is it for owners to be educated and really involved in the decision-making process?
It's hugely important. The sources really emphasize the need for clear client communication throughout this. Owners need to understand, first off, that primary lung tumors like SCC are rare, but they typically malignant. They need to understand why those advanced diagnostics, like the CT scan, are so necessary for accurate staging and planning. And they absolutely need to know that surgery is the main, most effective treatment if the disease is caught early and localized.
And managing expectations about the outcome.
Yes, being really transparent about the very variable prognosis is crucial, explaining how heavily it depends on whether the cancer has spread and where it has spread, discussing potential complications of treatment, the costs involved which can be significant, especially for advanced diagnostics and major surgery, and throughout it all, keeping the focus on maintaining the best possible quality of life for their pet. Those are all vital parts of the conversation.
And maybe even touching on those potential environmental factors like smoke, even if the link isn't rock solid.
Yeah, I think it's reasonable. While the link isn't always clear-cut for individual pets, discussing the potential connection to things like secondhand smoke or maybe other environmental pollutants makes sense. Recommending minimizing exposure where possible is just good general health advice anyway. Ultimately, these kinds of complex cancer cases often benefit hugely from a multidisciplinary team approach, maybe involving an oncologist, a surgeon, an internist, and potentially referral to a veterinary specialty center that has all the advanced imaging and surgical capabilities readily available.
Well, that was a truly deep dive into lung squamous cell carcinoma in our pets. I feel like we've really covered it. We've looked at its rare but serious nature, the real challenges in spotting it early sometimes because the signs can be so subtle. We've talked about the essential role of advanced imaging like CT to really see what's going on and critically check for spread, the absolute importance of successful surgery when possible, and that dramatic, really stark difference in prognosis based primarily on whether metastasis has occurred.
Yeah, and we've shone a light on those really striking paraneoplastic syndromes too, the
Yeah.
painful bony changes you can see in the limbs of dogs with hypertrophic osteopathy and those swollen painful toes and paws in cats with feline lung digit syndrome. There's such unique ways this underlying lung disease can actually show itself, sometimes first.
Absolutely. And hopefully this knowledge isn't just, overwhelming medical jargon. It's really meant to be empowering for you, the listener. It helps you understand the potential journey of diagnosis and treatment if this, heaven forbid, ever became a concern for your own pet. It helps you ask informed questions of your veterinarian and maybe grasp why certain tests or procedures might be recommended.
Exactly. Being informed helps you partner with your vet.
So here's maybe something to consider as we wrap up this deep dive. Given that those clinical signs can be so easy to miss initially, maybe just written off as old age or arthritis, and knowing just how dramatically the prognosis changes the moment this cancer spreads, especially when it spreads to surprising places like the limbs or the toes, how might simply being aware that unexpected lameness or swollen toes could potentially, even if rarely, be a sign of something serious starting in the lungs? How might that awareness fundamentally change how quickly you or your vet think about looking specifically in the chest? Potentially catching this disease at that much earlier, much more treatable stage. Something to think about.